Are you a PT or an OT who's thinking about becoming a clinical director? In this video, I'm going to be going over the pros and cons of going into directorship coming right up. Hey providers, welcome back to the channel. My name is Will Humphreys. I'm a physical therapist, I've been a clinical director, and I've been an entrepreneur owning multiple locational companies. I know what it's like to bring in directors and train them, so I know the pros and cons very well. So to help you make this decision, we're going to go over the cons first and then go into the pros. But if you're new to this channel, before we do anything else, please consider hitting that subscribe button. My intention is to share my business information with you so that you can increase your income, impact, and freedom in healthcare. So let's kick it off with con number one, getting burned out. Clinical directors are more prone to getting burned out, most of the time because they are taking on a full patient load if they're working for a specific company, and in addition to that, having to do their administrative responsibilities. Small private clinicians do not understand how to manage their directors, so oftentimes that's a position that has to fill in the gaps in their own time. So these are usually very powerful PTs and OTs, unfortunately, that end up having to work above and beyond an already heavy caseload, which leads me to con number two, that the director usually takes on all the dump. What does that mean? Well, PT practice owners get dumped on all the time because they take on all 7 divisions of a company. And when they take a director on, oftentimes they're just pushing all of that responsibility onto the director. I've seen directors market, oversee billing and collecting, in addition to treating, hire, fire, the whole gamut. So anything that the owner can't handle ends up falling on the director, which is too much to handle. And that leads me to con number 3, dealing with high emotional situations. Directors are the ones who have to mitigate unhappy employees. They oftentimes feel like they're stuck between the administration, the owners if you will, and the people that they're supervising. They feel like sometimes they're in the middle between what the employees want and what the owners want, leading to burnout. So that takes us to pro number 1. The first pro of becoming a clinical director is learning. Clinical directors are able to not only be powerful PTs, but they learn how to run a business. Even if they're thrown to the wolves, they're given opportunities to be able to grow. And unfortunately, even though that growth comes with some stress, no matter what, they end up becoming more professional and more business-minded. Pro number 2, clinical directors have the opportunity to make more money. This is a common avenue to increase your income. Now, if you're working for a company that's not well organized, that income may not be worth it. But I promise you, if you're working for a well-organized company or someone who's just empathetic, you can make more money while you increase your impact, which is also number 3. The third pro of being a director is an increased impact in patient care and for the other employees. That director is the heart of the clinic. And so the clinical director is able to impact patients' lives by controlling the experience, making sure it's done ethically, and that the provider's needs get met. So at the end of the day, even though you're dealing with emotional circumstances, you become a better human being, which is the bonus pro of this whole thing of being called a director. As you develop as a professional, you become a better husband, wife, father, mother, whatever it is you're doing at home. Clinical directorship develops you into a better human being, without a doubt. And so I hope this information was useful. What did I miss? Put that in the comments below of any pro and con that I neglected, and tell me your thoughts. Is it worth it to you to become a director? Thanks for watching. Until next time.